Hello, everyone, and welcome to the Toronto General and Western Hospital Foundation's first ever virtual Q&A. I'm Christian Cote, host of the UHN podcast, Behind the Breakthrough, and I'm coming to you live today from my home. And it's so nice to have you with us wherever you are as we all practice physical distancing and staying safe. You're all an important part of our community of supporters, and we want to say thank you to all of you on behalf of the Foundation and all of UHN. So with the fast-moving and fast-changing times in terms of the information out there about COVID-19, some of it conflicting, we wanted to give you an opportunity to put your questions directly to our experts. So joining us today, we have Dr. Susy Hota, Medical Director of Infection Prevention and Control at UHN. Welcome, Dr. Hota.
Thanks for having me, Christian.
And we have Dr. Bradley Wouters, Vice President of Research at UHN. Hello, Brad.
Hi, Christian. Nice to be here.
Both Dr. Wouters and Dr. Hota are helping to lead UHN's fight against this pandemic, from patient care and staff safety to research. Now, before we dive into your questions, a couple of housekeeping items. If you're having trouble reading the questions on the left panel of your screen, go to the bottom right, and you'll see a little, on the YouTube page, you'll see a little icon, a frame icon. If you click on that, that'll take you to full screen mode. Also, we had such an overwhelming response from you for questions that it's going to be difficult to get to them all. So to help us with prioritizing those questions, you can help us by going to slido.com, that's slido.com, and type in the event code. You can see it there. It's hashtag L190. So if you click on that, it'll take you to the Slido page of all the questions. You'll see a little thumbs up sign. If you click on that, that'll help push up the questions you want to see answered in priority. All right. Let's get to it. The first question in the queue goes to Dr. Hota. Dr. Hota, is it better for us to wear gloves and some sort of face mask while outdoors, going to work, and or grocery shopping once a week?
I'm not a big fan of people wearing gloves around for the primary reason that you just don't pay attention to washing your hands as well when you do wear gloves. So, I don't think there's really a role for wearing gloves out in public. The face mask is a really interesting question. So I think people are probably aware that the CDC last week and the Public Health Agency of Canada this week did make a recommendation that people could be wearing non-medical or cloth masks while out in public as something that would be an additional measure to help with preventing infections being transmitted, in addition to, of course, the social distancing or physical distancing we've been recommending. At the same time, the WHO has come out with a statement saying that masking is really not of much utility in the general public. And I think what that reflects is that there's just some controversy as to just how much this kind of intervention would actually help people reduce the transmission of virus, and recognizing that we want to make sure that masks are available in hospitals and where we really truly need them, and that the most important thing the public can do is maintain distance between themselves and other people while out in public.
Next question, actually also for you, Dr. Hota, from Arnold. What are the chances of a second wave of pandemic in future months? And will it be more or less severe? Is the entire population testing for the antibody the only practical way to ensure people are non-infectious? And how long would it take to put this in place?
Yeah, that is $1 million question, the first one at least. What's going to happen after we go through the first wave of infection? And I think the big concern is there can be a second wave, especially if you stop the physical distancing and the other sort of restrictive measures that we've put into place, the public health measures, too early. That would be a risk. So nobody really knows how this is going to play out. And we're watching very carefully as places like China have come through the worst of their first initial phase, and watching how well things are going after that. The next part of that question is interesting too, about antibody testing. That is one way that we would have a much better sense of exactly how many people out in the public have been exposed to the virus and infected, because we do know that some proportion of people will have an infection and not show symptoms. So we don't necessarily know about those cases right now. It's going to help us to understand how the overall dynamics of this infection play out. It may not necessarily change the way that we act, but it will be a useful measure for us to see just how big a wave we can face in the future if a second wave does come.
And a question from Shazia, I think also this is appropriate for you, Dr. Hota. Once you get COVID-19, are you immune to it? Is there one strand going around or several?
At this point in time, we aren't aware of different strains of COVID-19 going around. We believe that once you've had the infection, you'll probably be immune to it. The real question is, when does that immunity develop exactly, and for how long will it actually last? So many other coronaviruses that circulate around, people become immune to it after they've been infected for a short period of time, but several months later, they may be susceptible to getting it again, which is why you see a lot of seasonality to those infections.
And Dr. Hota, do you think there's a risk of being exposed to suspended airborne COVID-19 carrying droplets as one rides a bicycle or motorcycle through the streets, droplets that may have been projected by previous passing by pedestrians? What about from someone in a car ahead of you?
This would be very unlikely. At this time, there's no indication that this is an airborne virus that's transmitting through that route. If it was, we'd see much higher attack rates. And there's certain circumstances that we can look at, like what's happened when people are infected with COVID-19 and they board an airplane. We have not seen the entire airplane come down with illness. So we just aren't seeing the epidemiologic information or support for this being something that could be transmitted through airborne route. The vast majority of people who get infected have had close, more prolonged contact with somebody else who is sick with COVID-19. And that implies that it's larger droplets that you expel when you cough and sneeze and you're infected with the virus that actually cause the infection to be transmitted.
A question from Stephanie. Advanced age and comorbidity aside, what accounts for the very wide disparity in the severity of cases?
So
Want me to jump in?
Absolutely, Brad. Yeah. And Susy, if you want to comment as well, by all means. Brad?
Well, it's a good question. This particular disease actually shows a bit of an unusual sensitivity to age. And one of the, most striking aspects of that is the apparent resistance that young children have who for seasonal influenza and other infectious diseases may often be hit much more hard. We don't fully understand that. This likely has to do with the immune system and the way the immune system is reacting to this virus. And there's a lot of research going on trying to understand that. Obviously, we see a lot of disease progression and more severe aspects of disease in older populations that have other comorbidities. And again, some somewhat unusual patterns seen in those populations as well. But this is an active area that is currently under investigation.
Thanks. Dr. Hota, did you want to add to that?
No, I think that Brad covered a lot of it. These really are the risk factors that we know about that seem to result in more severe cases and mortality, age, and other health issues. I guess the question is, why is it that certain countries have a much higher case fatality rate regardless of this? For example, in Italy, and we really don't know what's driving that. Some of it might have to do with also how the health systems responded to it, just the pure pace at which the outbreak has progressed, things related to the system that aren't so much about the individual people who are actually getting sick, and that might be affecting the outcomes in those individuals.
All right, next question. I see perhaps Dr. Hota, if you could take the lead question, and then Brad, you follow up. Dr. Hota, this is from Jenny. When shall testing for COVID-19 be available for the broader public?
So, testing is available for the broader public, but right now, because of some lab testing capacity issues, we've been trying to keep it to certain groups that are at higher risk for either transmitting the virus to others rapidly and easily, or who are at higher risk for passing it on within healthcare settings. So those that we really want to conserve, healthcare workers, people who work in long-term care, et cetera. I think that in an ideal world, we'd be testing a lot more people. I guess to me, it sort of depends on what the action is that's tied to it. So we can still manage this outbreak by making sure that everyone who knows that they are symptomatic or ill with this is doing the right thing, self-isolating at home. That is, to me, the most important piece of advice we can give. And we should be trying to use our testing judiciously in areas like hospitals and long-term care, where we need to manage things a little bit differently, and decisions about how we manage the patients and their care also bank on the testing. We should be trying to prioritize some of those other groups when we have limited capacity for testing.
And Dr. Wouters, the second part of Jenny's question for you: recent studies have demonstrated the use of hydroxychloroquine as an effective treatment for COVID-19. Has UHN conducted any studies to support the use of this drug or any other?
Yeah, so this particular drug has gotten a lot of attention, mainly because of the president in the United States, who has talked about it a lot. It is a drug that's under investigation. There's some limited data that has been presented by a group in France and one in China early on a small number of patients, suggesting there may be some benefit, but it's one that needs to be evaluated in the context of a proper research study. That is underway, and in fact, here at UHN, we are part of a larger national initiative to do this, and is actually under the auspices now of the World Health Organization to run a worldwide trial to investigate this drug and several others that show or there's believed to be some promise for this. What's really important in the context of a pandemic like that is that we do organize ourselves, that we collaborate internationally like that, so that we can put patients on and gather data, evidence that is going to be definitive and be able to guide us with real evidence-based decisions. At the moment, we don't have that. This drug, like all drugs, can have other side effects. There are patients that probably shouldn't be taking it that may have other conditions. And so the proper way to do this is in the context of a controlled trial where that is being closely monitored and for the benefit and protection of the patients.
Thank you both. Next question, and I would put this to both of you if you like. When things are under better control, how will we slowly return to our new normal? Dr. Hota?
Yeah, great question. As time goes on, it certainly seems like normal is a distant memory. Things really have changed over the last several weeks, haven't they? It's really important that we not rush that change. I think that's the message we need to get to the public. It's been difficult to adjust to the current normal. I just think that we need to be really cautious to not step into wanting to go back to what life was like before too quickly, or else we risk having to do it all over again. So not really sure how long it's going to be. I don't think anyone does, but important for us to just keep our patience with the current measure.
Dr. Wouters?
Yeah, I mean, it's going to take some time for us to have a vaccine to protect people against this. There is a lot of infection out there, but the vast majority of the population is still not infected. It's, as Susy said, it's going to be extremely important that people don't, as we see cases start to drop and some of the anxiety start to fall off, that we don't relax these important measures that are being put into place, primarily physical distancing. And, our governments are going to have a difficult time thinking about how to phase back, having people to come back to work under those situations, but also having in place a good testing and screening strategy in order to find those little outbreaks that are likely to occur for some period of time and try and prevent this need for a wide scale, worldwide kind of lockdown like we're in now.
I've seen these next two questions competing, going back and forth. So we'll start with Cheryl McEwen's question and start with you, Dr. Hota. What does the hospital need urgently? Masks, ventilators, or other equipment? What would you like to tell people about that?
Yeah, I think all of those are important things, and we're trying really hard to procure whatever we can in terms of personal protective equipment, or PPE, which includes masks, but also other items like face shields and gloves and gowns, and then of course medical supplies and medications and drugs that we would need through all this when our supply chain is disrupted somewhat, and ventilators. A lot of focus on ventilators as well. We're looking into all of these things, hospital beds. So I think many items are needed at the moment, but also support for our staff. So, a couple of the things that are mentioned here, like food for staff, that is an important measure. And so we need to make sure that our staff feel supported through a very stressful time as well.
So thanks actually to Cheryl for asking that, because that gives us an opportunity to bring up the fact that for anyone interested in donating supplies or support items to staff and in terms of PPE, that sort of thing as well, you can email the COVID support at uhn.ca. Don't worry, we'll put up this email later in the broadcast at the end, but you are more than welcome, please. If you do have these kinds of offers to bring to us, you can email us at covidsupport@uhn.ca, and someone at the foundation will get right back to you. Brad, the second part of Cheryl's question, in terms of research, is there a shortage in what is needed to enable the researchers?
Well, there's always a shortage of funds to support research, and I have to say it's been extremely motivating over the last couple of weeks to watch the research community come together to pivot and to direct their energies against COVID-19. I've seen this across UHN, in fact, across all parts of UHN. Scientists and researchers and clinical trialists and the support staff that have come together and have launched a large number of new approaches and new ideas. This has also happened across Toronto. There's a lot of collaboration going on, even across the country and elsewhere. There's lots of great ideas out there, but we're limited to what we can do really by the resources that are available. So we're actively looking for funds. We've made some funds available from some unrestricted funds that were there. The University of Toronto has. In fact, the U of T launched a citywide competition for the best ideas. They had some limited funding available for those. There were over 375 applications from investigators across Toronto. So, this really has gotten the attention of the scientific community. They're working extremely hard on many aspects, from diagnostics to prophylactics to new therapies to vaccines. Looking at how that can be used to protect healthcare workers, how it can be used to help patients. It's exciting at the same time as it is challenging.
And for anyone interested in helping to fund research, that's another prompt we can send to people at the end of the show. But if you want to know, you can easily give by going to our website, www.tgwhf.ca/help now. Again, we'll put that up at the end of the show. Brad, I know I heard today that actually some of the researchers are actually on the front lines in the emergency department. Is that correct?
Yeah, in fact, a large number of our staff, we've had to suspend a lot of research activities that are not related to COVID-19. A lot of clinical trials are suspended. And so that workforce is pitching in. They're coming in and helping out in the clinic and, screening at the door and elsewhere. Lots of people volunteering to do that. I spent a shift at the door last weekend doing that too. And, there is a real Team UHN spirit here. Research and everyone else is jumping in to support that. The other thing I'd say is, some of our researchers are even spending some of their time trying to address those needs that Susy talked about in protective equipment. There's a consortium actually across Toronto that are converting 3D printers into making face masks, and there's actually a need to do more of that. We're looking for some funds to help support that, to help build face shields. We're also looking at approaches for potentially recycling or reusing some of the respirator masks. And there are several research groups looking at the best ways to do that. There are some good opportunities out there, really as a backup if and when we were in such a situation.
You know what, Brad, while I have you here, if you don't mind, I know there are sort of three major prongs in terms of COVID research that you have underway, about 40 projects, if I have that right. Do you mind just giving us a brief overview? Because I'm sure our audience would love to hear what you've got on the go.
Yeah, so one of the things we want to do is to learn as much as possible right during the pandemic. And, it's an unprecedented time in research for being able to capture data in real time, to share that data widely with other researchers around the world and to publish it quickly and get that information out there. And in fact, we're seeing, and Susy can back this up, is that we're seeing new data come out right during the middle of this that's helping to guide decisions that we're making, and to guide policies and guide thinking about how we're going to come out of it, like the previous question. And so it's important to be able to capture that information. And we've put in together a UHN-wide protocol that would allow us to capture data from all of our patients real time, to analyze that data, to be able to share that data. We've also put in place what we call an umbrella trial structure, and this allows us to launch very quickly many different kinds of therapeutic studies or prophylactic studies underneath it. And we work closely with Health Canada to get that approved. The first of those studies actually was just approved today by Health Canada. This is a world record for us. This was 2 weeks from conceiving the idea to Health Canada approval of the trial, something that would often take a year or more has happened in 2 weeks, and that trial is being started. One of our other trials got started today underneath that same rubric. And then we're also launching trials designed at our healthcare workforce itself. So for example, providing testing to measure the prevalence of infection in our healthcare workers, eventually those serology antibody kinds of tests to be able to identify who's been exposed and developed immunity to it. There's also a study underway by Kevin Kane that's looking at drugs that could protect healthcare workers from being infected, those that remain at higher risk than the global population. So a huge amount going on. We're doing that largely in collaboration with other hospitals around the city and other hospital organizations around the world.
That's great to see. And again, at the end, we will put up the various emails and contact emails and websites for people if they have offers of donations or goods, that kind of thing. Dr. Hota, back to you. A very practical question, one that I would love to know the answer to is, do I need to disinfect my groceries?
Yes, I get this question from my neighbors all the time, actually. It's largely not practical to have to disinfect all your groceries, especially since many of your items are going to be made with cardboard or packaged with, soft plastic. When you have hard plastic surfaces, you can wipe them down and do your best with it. But really the most important thing that you can do is wash your hands after you've been handling things that have come from the public. This virus likely doesn't last longer than a few days on most surfaces like plastic. So, over time, you won't have to worry so much about it, but just washing your hands really vigilantly is the best way to go.
And also, Dr. Hota, from April, how does the virus spread from asymptomatic people? I thought the virus spreads through sneezing and coughing, but you wouldn't expect asymptomatic people to do that.
So, asymptomatic people may shed virus from their nose or from the mouth, and it might get onto the hands or onto surfaces around, because not only is it large droplets that transmit the virus when you cough and sneeze, but you can also shed the virus into your environment, and then those that touch the environment around you can then get infected if they touch their eyes and nose and mouths. So that's presumably how asymptomatic people can actually get the virus to others, but it's likely less efficient than if you're and you have lots of symptoms. So that is an important factor to keep in mind, even though we know people can have asymptomatic infections, so they don't show signs or symptoms of the infection, but they have it. It doesn't necessarily drive the transmission as much as if you were, clearly symptomatic and getting it out into the environment.
Thanks, Dr. Hota. Staying with you, actually, I should apologize, though, to the last person who that question came in from Anil, not April. Sorry. Dr. Hota, is it okay to handle home delivery newspapers and magazines?
Again, this is very similar to the groceries question. It is fine to handle these items. You just have to make sure that you wash your hands after you've touched them.
A big picture question that I think both of you would like to hear your thoughts. Can you predict how the healthcare system, or UHN specifically, will be forever changed by this situation? What are some of the things that you can already tell will be different post-COVID? Dr. Wouters?
Well, it is a once in a generation kind of event like this, so it's really hard to make a lot of predictions around that. I think, for me, one of the things I've seen is the speed and efficiency and impact of what can get done when people are really rallied behind one idea and one kind of common purpose. And that's a spirit of, that certainly I want to take forward from this to help us, continue to move along faster in research in all aspects that we're doing. That includes collaboration across departments and units and hospitals at UHN, but also the wider scientific community. And I think it's a reminder to all of us about the power of working together like that.
And Dr. Hota, anything to add?
Yeah, I mean, I guess it's more about what I hope will actually come from this than what I predict will come from it. And my hope is that from this experience, there'll be some changes in the way that people view things. For example, how healthcare workers view coming to work when sick. That is such an important thing for us we've got to change the mindset around that. And it's been something we've struggled with season after season with influenza. And so I'm really hoping that this will be what shines a light on how important it is to take care of your own health and not come to work when sick. I also hope this will shine the light on the importance of infection prevention and control within hospital settings, but also public health outside of hospital settings, how we really need to keep a robust system alive so that we can respond to these kinds of problems. I know Brad had mentioned this is a once in a generation experience. When you think back, we actually have just 10 years ago experienced another pandemic, although far less impactful than what we're dealing with right now. So I think these emerging infectious diseases are a reality for us that we have to be prepared for. And then finally, speaking to what Brad's already mentioned as well, is just how data-driven we have been in our response and how we've learned from people's experiences across the world so rapidly and changed the way that we've responded here. Publications coming out in scientific journals and even being available in preprint, which has to be taken, cautiously because it's not necessarily been reviewed rigorously, but sharing that information really rapidly has been a game changer in my mind. And I think we're going to see more of that, hopefully.
It's terrific in terms of the collaboration. It's great to see. And it also highlights Toronto as a hub for leading research that really goes worldwide, doesn't it? Okay, Dr. Hota, if a person has COVID-19 disease, at what point can we be confident that they are no longer infectious?
This is also an excellent question because the amount of time that people shed the virus after they've been infected is so variable. And it can be as long as over a month for some individuals. So some of that's altered by if you have immune compromise, your immune system's not working as well, by age and other factors that we will learn more about. But it's for reasons like that within the hospital and for healthcare workers, we actually retest people to see if they're negative before we can clear them to either come back to work in the case of a healthcare worker, or for patients be able to stop their isolation precautions. In the public, I think that, general rules have been formed by public health that kind of capture the vast majority of people, that by 14 days, most people will be less infectious to others. So they would then be able to stop the quarantine or the self-isolation at that.
And Dr. Hota, again for you, if you're outside and the wind blows, can it travel I'm guessing refers to the virus, can it travel in the air from the person across the street and infect you?
So that would imply that this is an airborne transmitted virus. And at this point in time, we don't have evidence to support that. The WHO actually released a scientific briefing a couple of weeks ago, I think it was the end of March, to try and clarify this, because after a couple of publications, there was some uncertainty as to what it meant. And the epidemiology, I mean, if you look at what's happened globally in the cases that we've seen, does not support that kind of transmission. We'd see far more people infected much more rapidly if that were the case. So as far as we know, this is not an airborne transmitted virus. And so it would be very unlikely for this kind of a thing to happen where the wind would blow a small particle that contains the virus in it towards you, and you would then inhale it and get sick.
Dr. Wouters, I'm going to come to you, but first I just want to let everyone know we are approaching the bottom of the hour, which was actually going to be the end of our time here, but apparently we've been given the go-ahead that we can continue for another 15 minutes. Both Dr. Wouters and Dr. Hota have agreed to stay with us, and we're hoping you at home can also stay with us for the next 15 minutes. Dr. Wouters, from Brian, as at this time, is there any indication that the virus has mutated from the time of initial infection in Wuhan? Are we able to tell yet?
So this is being studied quite carefully. There are a number of groups around the world, including here in Toronto, that are doing what we call sequencing of the virus. So you can actually look at the genetic sequence and identify mutations as they occur. Fortunately, it looks for this particular virus that it's not mutating very quickly. And that's good news, because it means it's likely that people that will develop immunity will have a higher chance of staying immune to it, and it won't escape that kind of immunity. There are small changes that occur and small mutations that don't have a big impact on the virus itself. And interestingly, this is one of the ways we can use to track it, because we can see if a version of the virus that someone has picked up here in Canada is very similar to the outbreak in Italy or the outbreak in Wuhan. We can actually trace where it came from. So there's a lot of genetic epidemiology going on to help trace and track and to use that information to understand the spread of this virus. But from a large scale picture, it's not mutating rapidly, and that's good news.
So it's quite stable, actually. There's a question actually I want to get to that I think we should read out too, because it's great to support people, and it's a great question that came in. Not so much a question as a comment. It was, on behalf of my family and I, thank you to all the healthcare workers who are working ceaselessly to help all those in your care at this very tumultuous time. Your dedication and sacrifice are truly valued and appreciated. Praying for our safety. So thank you to the donor who wrote that. It means a lot to Team UHN and the foundation. To you, Dr. Hota, from Debbie, how do you care for a family member that gets sick with COVID and is in your house full of other family members?
So the Public Health Agency Canada actually has a great document that is a resource that I've been sharing with people when I get this question. It is a little bit buried, but it is there. And it really kind of outlines how you can try to physically separate yourself a little bit from that family member who might be infectious to others. The importance of separating out items that they use and not sharing dishes and things like that. The importance of hand washing and other infection control measures within the home. Trying to keep the room that this person's staying in for most of the time while self-isolating, well ventilated, things like that. So there are some resources out there, and Toronto Public Health also has a how to self-isolate tip sheet that's available if you just Google their webpage. So a few things out there to help guide people, and it's not a perfect science. You really have to do your best, and again, rely on these very basic measures like trying to have physical separation and washing the hands
This question from Alexandra, I think this would also be for you, Dr. Hota. I am reading terrifying accounts of what it's like to have COVID-19, understanding that there are a range of symptoms and experiences. Are you able to describe what the average person might expect to experience if they become ill with COVID-19?
There absolutely is a range of symptoms, all the way from having no symptoms at all. So this concept of asymptomatic infection, right, which is a real entity, to getting, critically ill and ending up in the intensive care unit and requiring a ventilator, which is about, 3% of people. It's a small, on average, it's a small amount of individuals in Canada who have been infected who actually require that level of care. The vast majority of people, about 80% or so, to our knowledge, will have very mild symptoms. And mild symptoms can be anything like a cough or cold, flu-type symptoms, runny nose, sore throat, the cough or shortness of breath that's mild, and a fever. Sometimes people have a little bit of stomach upset with it. And an interesting symptom that people have made note of is a loss of smell and taste that can happen in some cases. Feeling tired and really worn down is not uncommon. I call them mild. You might feel pretty sick, like you've been hit by a truck, but for the most part, it's not that much worse than what you would have for a flu if you got the influenza virus, for example. Now, a smaller proportion of people will develop much more shortness of breath or chest pains, or start to get confused or have changes in their mental status. And those are signs that you need to go to the emergency department. If you develop those kinds of symptoms, you absolutely need to be evaluated to make sure you're not more seriously ill, and you may need to have an admission to hospital depending on what's going on. So that's really what you need.
Thanks, Dr. Hota. And from Anonymous, this is probably one I should handle. Can non-medical members of the public help support frontline workers other than staying at home, et cetera? Actually, that's probably the best thing you can do is staying at home. For example, can we volunteer to backfill for hospital administrative staff called to other duties or in isolation? Is it safe to do so? Thanks to you and your staff for your heroic efforts. Again, thank you for submitting this question. The foundation would love to speak with you if you have any kind of offers. There's this email address, www.covidsupport@uhn.ca. Sorry, that would be actually a web address, www.covidsupport@uhn.ca. And someone from the foundation will get back to you to help us or help us. This is from Adriel. Dr. Hota, was the relative speed in developing an H1N1 vaccine the result of extensive knowledge already existing regarding closely related pathogens? Is it the absence of such knowledge for SARS-CoV-2 that explains the 12 to 18 month projection for the development and distribution of a safe COVID-19 vaccine? Actually, maybe Brad, I'll start with you with that question.
Yeah, well, for seasonal influenza, and Susy would is really an expert. There is a worldwide network that is constantly surveying viruses, reporting those into disease centers. They're coordinated through the WHO, and the WHO each year, in fact twice a year, helps make decisions on guiding vaccine development, vaccine testing, to get it ready for when we have large-scale outbreaks. They make the best guesses or the best interpretations they can of the data and the viruses that are circulating and the vaccines that can be developed based on those from a small group of viruses. And sometimes those seasonal vaccines work really well, and other years they don't work as well. In this case, we're starting really from ground zero. The virus was actually isolated and sequenced extremely fast, within a month of its original identification. And so that has created many activities around vaccine development around the world. Some of these are actually being tested already in small numbers of patients. But the process of testing, ensuring safety, ensuring that it's effective and can work well, and then putting it into production for manufacturing and distribution and numbers that can be used for patients is really what creates that time frame of 12 to 18 months.
Dr. Hota, can you add anything in terms of vaccine research?
Yeah, I mean, I think with H1N1, we had the advantage of it being influenza, and we've got platforms and development processes in place that we use for seasonal influenza vaccine development that could easily be piggybacked upon. And so it was much more rapid to get a vaccine out. It was about, I think it was just over 6 months to get a vaccine available. And so all of that, including the regulatory processes you need to actually get a vaccine out, we're pretty much already done. And so we are starting from square one with SARS-CoV-2. I think that the time frame has been very accelerated in terms of vaccine development. And right now, to my knowledge, we have 3 candidates that are actually in phase 1 trials. But, the steps for vaccine development and rollout are numerous, and they include the regulatory approvals and making sure the safety and efficacy have been proven, not just in animals, but also in humans. And then the mass production is a whole other step that needs to be overcome so that it can be distributed to the public. So lots to be done within a 12 to 18 month time frame, which in itself is ambitious.
Just before we move on, I need to correct myself. I've been giving out what I thought was a web address. In terms of support supplies or items for the hospital, it's an email address, COVID support, all one word, @uhn.ca. So that's COVID, COVID support @uhn.ca, and someone at the foundation will help you out. Dr. Hota, if you get COVID-19, can you get it again?
So we don't believe that you can get it again right away, although there was a research paper that came out that I think caused some confusion because it showed that some individuals who had been positive for COVID-19 on testing had some negative test results and then became positive again. I think that probably actually reflected the fact that, because of the way that you sample when you take the test, and because the test is not 100% sensitive and being able to rule this out, it may have been false negatives in between. So to our knowledge, this is not something that you can get infected with again right away if you've recovered. However, like many other seasonal coronaviruses or other coronaviruses, it may be possible that months down the road or next year, you might be susceptible again, depending on whether the virus mutates or changes significantly, or your immunity just wanes over that time. We will have to wait and find out.
Another question for you, Dr. Hota, from Anne. Public health seems to be sending mixed messages to seniors and those who are immune compromised. Is it safe for them to go outside? Sorry, skipping around here. Is it safe for them to go outside for daily exercise as long as they can adequately maintain physical distancing?
Yes, public health has more recently put out a message saying that senior citizens, or in particular those over the age of 70, should be limiting their outdoor time, or not outdoor time so much as they're leaving the home. It's best to spend as much time as possible within your home. But, I do think it is important for us to be outside and getting physical activity, taking walks, getting fresh air, leaving your home environment, even for your mental health, because it is difficult to be in the same place for a long time. And so my advice is take those walks, get outside, just be very careful about distancing yourself from others around, and don't frequent areas that might be more heavily populated.
There's a question I actually want to get to that I missed, but I know it's an important one for you, Dr. Wouters. In recent communications with the foundation, I read that the government is providing funding for COVID-19 research. Why do you need additional research money?
Yeah, so the government has provided some funding. The Canadian Institutes of Health Research actually launched a competition and ran that very quickly to get some funds out the door. And some of our scientists, investigators here were recipients of those grants. In fact, I think 4 or 5 projects in collaboration, and 2 other projects that were led directly out of UHN were funded here. Those fund part of the costs of doing the trials and the infrastructure and so on that we're carrying out, but are nowhere near the funds that are required to do the kinds of studies that I've been telling you about. U of T made some funds available. The government of Ontario is doing so. We're seeing lots of charities and other places make funds available. And we're always looking for potential sources to address those ideas. In the competition I told you about at University of Toronto, there were over 300 applications. UHN scientists were involved in about 60 of those. And we have over 40 projects that we've launched here. Individuals are trying to repurpose funds they have, are trying to direct their staff towards those. But there are new costs associated with doing all of those. And, time is of the essence here. We want to move as quickly as we can. And, there's not a lot of time sometimes for our top clinician scientists who are busy looking after patients to be writing grants to granting agencies at the moment either. So
we have a few minutes left, so I want to try and get to these last few questions if we can. For you, Dr. Hota, can you share some information on COVID-19 patients, on COVID-19 and transplant patients, tips for transplant patients besides washing hands and keeping distance?
Unfortunately, it really comes down to those 2 things being the most reliable things that you can do to prevent getting infection yourself. Unfortunately, I don't know of any proven preventative medications or supplements or interventions outside of what we're saying as sort of basic infection control and public health measures. So limiting your time in public spaces, making sure you wash your hands really carefully and frequently, try not to touch your face, your nose, your mouth, things like that are really what it comes down to.
Absolutely. A question from Adriel. It seems that some countries have experienced success in lowering transmission by encouraging or mandating that everyone wear a mask of some sort, even if the mask is of lower homemade quality. Should that apparent success inform policies in Canada while we wait for more mask-related studies?
Yeah, this is something that's actually become quite controversial because we're getting different agencies recommending different things in terms of masking in the general public. The WHO is saying that is not an intervention that is proven. We don't have enough scientific evidence to show that this will help with reducing SARS-CoV or COVID infection transmission. And yet, the Public Health Agency Canada and the CDC are saying, this might be something you want to consider to putting on a cloth mask, in addition to the social distancing and other measures we're recommending to prevent transmission. I think it may have a benefit if you yourself are incubating a virus, like you have the infection, you're maybe not showing your symptoms just yet, or you have mild symptoms. And what it can do is kind of block the transmission to others by acting as a barrier. Beyond that, we don't have a lot of evidence to support using masks. I think that the most important thing is the physical distancing.
The time has flown by and it looks like we've run out of it, unfortunately. I'm sorry we couldn't get to everything. So many great questions. Obviously, there's huge demand out there, and I'm so pleased that the two of you could join us today. Great discussion. Thank you to our guest, Dr. Susy Hota and Dr. Brad Wouters, for taking the time to be here.
It's our pleasure. Thank you.
Thank you, and thanks to everyone out there who's staying engaged and pitching in to help out. We really appreciate it.
Thanks to you both. This live stream, just so you know, will be accessible anytime. Just go to the Toronto General and Western Hospital Foundation YouTube page to watch it again, or you can share it with friends or family. Also, we'll be sending out a short post-event survey. We're hoping you can answer a few questions about what you thought about today's live Q&A. And I want to reiterate what Dr. Wouters was saying earlier, that research requires donor support. It's absolutely critical to the work done here at UHN, and right now we need your support more than ever. So to help our staff on the front lines in the fight against COVID-19, also as well as researchers behind the scenes racing to discover a solution, if you're looking to help, we would ask that you consider making a donation. It's real easy. You visit our website, www.tgwhf.ca, that's TGWF as in father.ca /help now. That's help now, all one word. Every contribution counts. Thanks so much for tuning in today. I'm Christian Cote. Thanks and stay safe.